So I think we are now going to move on to some other queries that we receive often within the RCVS. And as you can see, the focus is on medicines because none of the scenarios that we have dealt with over the course of these 2 sessions have dealt with medicines, and we do receive queries about them often. So the first one is, can I advise that a client use over-the-counter human medicines for their animals? Do any of you have any thoughts on that? If you can pop it in the chat, that would be great. So things like antihistamines, paracetamol. So the key here is that even though they are over the counter for, oh, hang on. Yes, but I think I have to make them and sign them as an off-label use form. Okay, so I think probably you're on the right lines there. So even though they're over the counter, when they are human medicines, they are still technically a veterinary prescription because they are not licensed for animals or for use of whatever condition you're treating, which means they're technically prescribing under the cascade. So you need to make a note of why you're using it, why no animal alternative was suitable, and why you're using this particular medication following those stages of the prescribing cascade. There is on the RCVS website, there is specific information about prescribing human licensed paracetamol. So you can take a look at that. And additionally, the VMD has provided some guidance on the use of medicines commonly found around the home. And what the VMD say, and I'll read this to you because you might find this useful. It's an area that that can be quite confusing. So the VMD say, in exceptional emergency circumstances, you may judge there is a need to alleviate a pet's discomfort until a home visit can be made or the animal brought to the surgery. You could recommend that an animal owner use a human medicine that they already have in their possession, such as antihistamine tablets. This does not mean a pet owner should be encouraged to go into a pharmacy and ask for a human medicine for their pet. So in emergencies, yes, but it still counts as a veterinary prescription and it is technically prescribing under the cascade. So do have a look at our guidance on that if you get a chance. So the next one, how long are written prescriptions valid for? Any guesses? So just your normal prescription only medicine, how long are the prescriptions valid for? You can pop it in the chat or you can wave to me. 28 days is one guess. Any more for any more? Okay, so for your bog standard prescription and 6 months, well done. Well, you're both right. 28 days and 6 months, you're both right. I'll explain why. So for your prescription only veterinary medicines, it's 6 months unless a shorter period is stated. When you're dealing with Schedule 2 or Schedule 3 controlled drugs, it's 28 days unless a shorter period is stated on the prescription. So I think I can give you all the points. I think you're both right there. And of course, with Schedule 2 and Schedule 3 controlled drugs, those prescriptions are not repeatable. And this last one on medicines is one which I think we also get queries about on quite a regular basis. So what does it mean to have an animal under my care? Is that something that people understand well or not so much? RCVS is actually currently reviewing what it means to have an animal under your care and how that term is defined. So keep an eye on the RCVS website for updates on how that review is going, because the position may change in the future depending on how that review goes. There may be I think there will be a public consultation on the issue a bit later this year, so do keep an eye out for that. So what does it mean to have an animal under my care? So under my care is a phrase that comes from the veterinary medicines regulations, and it's to do with prescribing POMVs. And the reason it's relevant is because the VMR say you can only prescribe a POMV if you've carried out a clinical assessment and you have the animal under your care when you're a veterinary surgeon. And what we say at the moment is that in order to have an animal under your care, you have to take responsibility for the animal and carry out a physical examination immediately prior to prescribing, or recently enough so that you have personal knowledge of the animal's current condition or health status to make a diagnosis and to prescribe. So that's how we define it at the moment. However, as some of you might be aware, we do have a temporary guidance in place at the moment due to the COVID-19 pandemic that allows veterinary surgeons to establish undercare without a physical examination in certain circumstances. And that's very key, in certain circumstances. So again, if you have a look at the COVID-19 section of the RCVS website, there are some FAQs. I think it's FAQ 4 that deals with when remote prescribing might be appropriate. The Standards Committee are actually reviewing that temporary guidance on the 7th of February as to whether that temporary position stays in place or whether it reverts back to the previous position. So keep an eye out for that update as well. So I think that's all on that one. There's a question about prescriptions. If it is written on the prescription that it can be repeated, can it become valid for longer than 6 months? Good question. I think when you're doing your repeat prescriptions, I think it's probably the case. So it will say the number of repeats you can have. But it's a good question. I'm not sure whether it is valid beyond 6 months. You probably need a new one after that. I can double check for you if we have any time in the rest of the session. If not, perhaps Mari, you can email Emma with your details and I can email you the answer to that question. Yeah, if you no problem at all, Mari, just send your details to Emma and I'll answer your question for you. Just not one I've got off the top of my head. Social media, achieving balance. So how do you balance the benefits of social media? So sharing knowledge, building networks, kind of building a following, all of that kind of stuff with client confidentiality and professional obligations. And this isn't one that is kind of an easy answer, because obviously it will depend on the circumstances, but it's one that we think is important at the moment with the kind of rise in the importance of social media in society. And sometimes I think people forget that they are, they kind of think different rules apply online than they do in the real world. And that, I think, is the key when you're dealing with social media. So if you are on social media, then you need to behave responsibly online and not do anything online that you wouldn't do in person. So obviously you need to be respectful, don't make comments that are inappropriate, discriminatory, that are abusive, bullying. I mean, these things are obvious. You must maintain client confidentiality, nothing that can identify people, as we talked about earlier. And unless you have specific consent, and even then be very careful, because you shouldn't be sharing anything that brings the profession into disrepute or anything like that. So just be very, very careful when sharing details about patients. Make sure if you're disclosing any identifiable data that you have consent. And seek advice if you're not sure. If you're doing something that's going online and you're not sure about where the line is, then do speak to us about where you can draw that line. We're available to kind of advise on all of that kind of stuff. Okay, so I think we can move on to the next slide, which I think is perhaps some of the questions that were submitted in advance of this session. Oh no, it's not, it's the advice line details. Yes, so this is how you contact us, and I'll leave this slide there just for a moment. So it's advice@rcvs.org.uk and 0207 202 0789. All calls are treated confidentially, and you don't even have to tell us your name if you don't want to. You can just say, I've got this situation, please can you help, and we will. Please do feel free to use us whenever you've got queries. If it can wait, then send them in by email. If you would like an answer kind of more immediately, then do give us a ring. So we'll perhaps put that slide back up at the end so you can take that down if anyone would like to. So these are the pre-submitted questions that came in. So the first one, how to deal with a client that refuses to pay despite signing consent form and agreeing to an estimate for treatment. So this one I'm not surprised to see, because we quite often get asked about what shall we do, the client's refusing to pay. I think in in practical terms, you would try and resolve it. You will try and avoid this situation in the first place. You will be open, transparent, and so on about fees and how bills are calculated, and try and avoid these kinds of situations. But if it gets to the point where you're not making any progress and they still won't pay, you can put it in the hands of a debt collection agency, and I think we had reference to that in the chat earlier, and institute civil proceedings, and the sharing of client data with a debt collection agency does not require client consent. So that's an important point for our discussion earlier, given the practice's legitimate interest in so doing. If you have persistently slow payers and bad debtors, you can give them notice in writing that you will no longer be providing them veterinary services, but please bear in mind that you still have an obligation to provide first aid and pain relief to their animals, even where they're not paying and they're no longer your client. So I'm mindful of the time, Emma. We've slightly overrun on this session. Maybe we could, what do you suggest? Shall we?
Do you want to, I haven't got any questions coming in on Slido. Has anyone got any they want to put in the chat box?
We've been doing them as we go, so yeah. So we've actually already answered the second question on here about where you've got an animal who you think needs to be put to sleep in an emergency, but there's nobody there to give consent. We dealt with that earlier. I think how to break bad news, that's a difficult one, and one that I'm not sure. It's one that was asked several times actually in advance of this session and in the last one, and there's no, one way to do it. And I think that's probably one to discuss with more senior colleagues about what their advice is on how you can do that in a way that's kind of going to get the message home, but in a way that's kind of sympathetic and appropriate for the client. And the last one, when do I read the code of conduct? Before I start work. So yes, I would advise that. Do have a look at the code of conduct before you start working in practice. If you are working in practice and you haven't looked at the code of conduct, do have a look. Our registrar will be doing a session to those of you who are final year students if you're at university in the UK. We'll be doing a session at all of the vet schools to final year students on the code of conduct and supporting guidance. So you'll learn a bit more about how it all works. But the code itself is very short. It's just principles based, and it will give you those kind of high level principles to carry with you as you go into practice, and kind of the basics of what it is to be a veterinary surgeon and practice appropriately. It's got links to all of the relevant supporting guidance as well. So I think that's probably all I have to say about these questions. If there are any more, I can take a couple. You can just pop them in the chat. Or if not, then we can say goodnight, and thank you very much for coming to the session.